So there's a number of things that can cause proprioception problems. We do see that as people get older, they tend to have a proprioception problem. But I wouldn't say age causes it per se. There is what we call idiopathic peripheral neuropathy, which is a big fancy word for we don't know what's causing it. And so there's a lot of idiopathic of a lot of different diagnoses, and it's basically we don't know. There may not be any history to the person to explain why they have this problem. There's nothing that adds up and they just have it. And so the key there is to just recognize that's there and then to empower them to get back to living their life as independently and productively as possible and to get around as well as possible. Other things that can cause it very commonly, back problems, back surgeries. So if you're having, back issues, especially with radiating pain down the leg, back surgeries, those sorts of things, neck surgeries, same thing. And the reason for that is because there can be damage at the spinal cord or at the nerve that comes out of the spinal cord. And so if you think of, let's say, like a bulging disc, so people have problems with a bulging disc and it presses on the nerve, and that disc keeps pressing on that nerve over time and it can wear away on that nerve. And so it depends on where the damage is on the nerve, but people can live months and years in this way. And so down the road, they can experience all sorts of sensory type problems, numbness, pain, tingling, but it's not always those things. It can be something more subtle like a proprioception problem, and that's often unrecognized. So then they find themselves years later falling randomly, and they don't know why. And what's actually happening in that sort of a case is they might have a vestibular system or inner ear balance system that's gotten older and not as strong as it used to be. They may not be as quick as they used to be. And then on top of a proprioception problem, they start falling. So it's accumulation of all these things. Other things that can cause it, just, orthopedic injuries, repeated sprained ankles, can cause it, toxicities, cancer treatment and things like this. So sometimes we can look at the person's medical history to say this could be a contributing factor to this. But sometimes we just don't know. And so idiopathic peripheral neuropathy. The main thing to know is to recognize that it's there, how severe is it, and then what to do about it.